She's actually been seeing me for 22 years. She's one of my oldest patients here. So we're gonna cut her nails, and hers are not overly complicated, but they do curve around and they then cause issues for her. And I know in the past when I've cut her nails, I've been doing this for so long for her that there's a couple of them that she will actually, it'll make her wince a little bit because the skin grows with the nail. So I have to be real careful when I cut these. And if I go a little bit too quickly, it actually hurts, or sometimes she'll get a little bit of pinpoint bleeding. And you can see right there, these little spots right there is where the skin grows with it. And if you look at this one before I cut it, you can see that too, right under there. There isn't much we can do for that. I try to cut it as short as possible, and I cut around that area. That's fungus in the toe. It's also callus growth from a chronic fungal nail that you'll never be able to get rid of because of the diabetes. So I can take the clipper to this. Sometimes that's painful, or I take my Dremel and just kind of smooth it down. I'm gonna use the Dremel on her because it's a little bit sensitive for her. And you can see on this one, I have the same issue too. It's growing into the skin, and then underneath it, it has all this fungus and callus tissue. On a toe, we call it a corn, so it's really a corn under the toe. And this one we're gonna smooth down too. All I'm doing is trying to get it as comfortable as possible, cut it the way the nails grow into it. I'm gonna come back and smooth all this so it looks better. This one you can see over the years I've been trying to cut it back, but at one point when if she goes longer than a couple months without cutting it, this callus and corn will actually grow outwards, almost like a nail. And it looks like a piece of nail sticking out there when in reality it's not. So again, on this one's gonna be more dremeled than anything. I'm gonna cut around it, and this one you can see really curls into the corner. Now she doesn't complain of ingrown nails. Part of it is because she's diabetic and she's lost the feeling in her feet. That's a big part of it. And also because they just don't hurt her. Even though when you're looking at it on film, it looks actually worse than it really is. It looks like it would be really painful, but it's not that painful for you, is it?
No.
Okay. So she doesn't really notice it, and she never really comes in. She comes in every 9 weeks, but she never really comes in and says, oh, my nail's killing me on the side. So we just cut it to be comfortable, and you can see I just cut it back about halfway. Try not to get her to bleed. And on this one, I'm just taking chunks of it. And I know it looks like I'm going backwards, but what I'm doing is trying to get the loose part first because it's easier to get the rest of it because this nail is so thick. So you can see this one too is curling under, and that's gonna be a little bit sore for her. And I'm gonna clean out the corner right here. Not an issue for her, but I don't want it to be an issue for her. But again, it's not red at all. You can see it's curved as it is. This is not causing an issue for her. If it were causing an issue, she would have callous skin here. It would be red, and there would be drainage. And then this side here, you can see this is very thick. This might pinch a little. She might feel a little pinch up there, okay? And we're gonna clean out the corner here. And I'm not gonna be overly aggressive. I can be really aggressive with this and cut this all the way back because you can see this is curving all the way down there. But again, it's asymptomatic, which means there's no symptoms. And it's not showing any signs of a problem, meaning it's not showing that it's red, swollen, or calloused on the side. So we're not gonna mess with it. We're just gonna keep it cut like that. Now we're back to nails that look a little bit more normal, but there is fungus in it. If we sent this for a fungal culture, it would come back fungus. I can see the discoloration, and up close, when you're watching this on your computer, you can probably see that it's discolored too. These mainly are just the ones that we have to be careful with because of the extra corn underneath it and the extra skin underneath. So we're gonna be real good with this as far as cutting around the skin. And this actually, over time, what's happened on this one is a lot of that skin that's attached to the nail that grows with it has actually regressed, meaning that it's gone backwards and it's not as prominent as it was before, which is good. And that just might be from doing this every 9 weeks. And the reason we do it every 9 weeks, usually it's an insurance issue. In the United States here, insurance companies like Medicare will only let diabetics come in every 9 weeks or longer, unless they're having an issue. So now I'm gonna take my Dremel tool. This is gonna make her jump. And you can see she's jumping a little. Part of it is because of the vibration, but a big part of it is when you have diabetic neuropathy, your nerves can either become dead where they don't feel anything, or you get hypersensitivity of the nerves when they're dying off with the neuropathy. So any vibrational sensation will make you jump a little bit. And that's really more of a reaction that she's having. She's not doing this on purpose, thinking that, oh no, I've got something on my toe. It's actually, her body is just reacting because her nerve endings are hypersensitive. And you can see right here, this is that callous skin on the end of the toe. If you look, you see what I'm doing here? I'm taking this down pretty far just so it's not an issue for her. And we're also going to smooth it around the end. And this one too. It's the same thing at the end of the toe. We're going to get this down. If we go a little far, it would bleed. So we're careful to just take it just to where it's flush with the nail. So it's one smooth area at the end of the toe. And that way it won't touch on her stockings. The big toes are a little bit trickier. What I do on the sides of it is try to just make the part that grows in a curve fashion. I try to make that real smooth and real thin so it doesn't dig into the side of the toe. This side too, where I've cut it back, I'm going to take my Dremel into the side where it would grow in, and I'm thinning this and thinning the skin at the same time. It's a little bit thicker there, just so this is not an issue. Now yes, there's still some nail in there, but again, this won't be an issue for her, and that's because it's so thin on the side now that I've Dremeled it down, that it's not going to cause her any pain when she's wearing a closed-in shoe, if that's what she decides to wear. And she does wear a closed-in shoe. We really encourage her as a diabetic to wear closed-in shoes to protect her feet. And we're doing the same thing on this big toe. We're going to smooth the side of it here. And I'm trying to get this, and she's real touchy, so I have to hold her foot and anticipate that she is going to jump, and she's pulling a little bit. You okay up there? You doing okay? Yeah. Okay. Not painful for you though, right? Is it painful or is it just touchy? Painful a little? Okay, not too touchy. Okay. So just a little touchy. And on the top of the nail, I'm looking down on this nail and I'm trying to get it flat from my perspective. And that's just so, again, so it's not an issue in the shoe. So I'm taking the side of this down and I'm going around the area where the skin is callous and the nail is thicker. Again, the big toes are always the most difficult ones to deal with. But the more we grind it down, because it's so slow growing, when she comes in every 9 weeks, she doesn't have any problems with it, with the ingrowns or with the thickening of the toenail. And now we're going to get these other lesser toes. Again, these don't have the corn at the tip of the toe like the left foot. And that's probably because we've done this so many times that the corn is not coming back as fast. Corns usually form as a reaction of your body having too much pressure in one area. And that's what happened to her over the years. So now let's take a look and see if there's any extra skin that needs to be smoothed down. That's just a little bit of extra skin, but nothing that's real bad. These calluses are almost nothing. We smooth them just to make sure they look good. And now, one last final touch. This will give us a good look at what the nails actually look like afterwards. We can put, if we wipe these down with alcohol, this will give you a better look. And I'm going to have Casey take a close look at that and show everybody how you can see that now there's no more corns on the end of the toes, and the nails are smooth and thinned out. You can take a look at the end of the toes. And that's really it. She's going to be real comfortable. She can wear her closed-in shoes. She'll wear her diabetic shoes with special insoles. We have special insoles to take the pressure off of pressure points in her feet, and there's plenty of room in